Hi guys, today we will discuss about the hospital posting in the Masters in Hospital Administration curriculum. So in this video, we will talk about OPD, what an MHA student has to look for in when they are posted in OPD department. So as an MHA student, we are actually, when we get hospital postings, we will be little bit confused what to ask, what to do, how they will, we will be basically not knowing much. So in this video, we will talk little bit about what all things we have to assess, and there are more things to assess actually in a hospital. So these are the little kind of information. So when we go to a hospital, what we usually see, when we hear a hospital, we used to think that there is some nurses are there, doctors are there. When we used to go there, we used to see that. Then when we think of other clinical aspect, like that in MSc we used to say that hospital it is clinical and non-clinical. So in clinical aspect, if we look, then we think about operation theater, then we will see lab, pharmacy, like that many departments are there. And the non-clinical aspect, when we go inside, we see registration is there, billing is there, some accounting is there, something related, all those things are there. But when we come to MHA, that is Master in Hospital Administration, we get to know that there are many things going on in the hospital, and not just that what we know like billing and all. It is more like there is quality is there, then operations is there, and many departments are there which we are not aware of. These things we get to know in the MHA curriculum. In OPD, there are different kinds of patients that enter in OPD. That is first, when directly a patient goes to a hospital, that is the general OPD. And then in the case of emergency, when there is an accident or something, then there is an emergency OPD is there. Then there is referred cases also, when the patient got started their treatment from somewhere, and then they had to do further treatments, like that a kind of particular specific treatment was not available in that hospital, and then the physician or someone, they will refer to this hospital. That referred cases will also come in OPD. So this is the first point of contact when in a hospital. So OPD is the first point of contact where the patient gains access to the hospital. As a MSc student perspective, if we go to a hospital, these are the things that we find. So first thing we will discuss is about OPD. Do you know what is OPD? The OPD is actually is outpatient department. Something related, we used to hear OPD, IPD and all. So OPD is outpatient department. So when a patient or when we went to a hospital, the first thing we used to see is registration. We used to see there is inquiry, help desk is there, and there is a billing area. All those things we used to see. There is insurance, something and all. When we go, first thing we used to see is registration. So this is where the basic thing starts, OPD. So as an MHA student, when we go to hospital postings, the first thing in OPD that we used to see is that how they are functioning. So basically, we will be looking the location. So OPD mostly it will be located in the ground floor, which is easy access to the patients. While they come directly, they can enter the OPD, no. And then when they enter, the first thing they may be seeing is the registration area. There will be inquiry desk, because when the patient comes, obviously if it's a new patient, they won't be knowing where to go, and they may be having lot of questions, and they will be in a situation where they like kind of tensed situation. So they will be needing an inquiry. So the main OPD area, the entry area will be more like inquiry, and registration will be there for new patient, and there will be another registration maybe for old cases, repeat cases comes now. So for that also there will be another registration. So when a student goes to an OPD in the registration section, first thing we will look is that what are the counters. Like there will be registration counter will be there, there will be a billing counter, and then there will be admission counter, and then there will be an insurance counter. So we will look for those counters, and we will try to find out why those counters are there. Like there is a process going on. What are the process of the billing, how are they doing, registration how they are doing, admission what is the process, all the process we have to actually observe and analyze it. And then we have to ask them about the doubts whatever we have, and we have to know the entire details about the process. We will have to know about the floor plans, then we will have to know what are the problems that the staff are facing. We have to know about the number of staffs, then we have to know their duty schedule timings, then their salaries we have to know, and there will be a specific objective for every department. Then there will be like organization structure, like there is a hierarchy, we do call it organogram. Then that this thing like who reports to whom, who's in charge of what, all this stuff we have to know. All this information we will get to know from hospital postings only. So these things, like basically how it is functioning, and then we can assess and see how the patients are there and what all the problems they are facing. And then all these things, while going for hospital posting only, we will get to know. By just reading the theories we won't be knowing all these things. And then there are consultation charges. It will be different for every doctors, like there will be specialty, there will be different consultation charge, super specialty it is different. And there is something like OPD and non OPD consultation also. Like for OPD days, for a particular day some doctors are available, for that duty doctors are available, for them the consultation charge will be something. And for if a patient wants to consult a particular doctor, and that doctor's OPD day is not that day, that doctor is not in OPD duty that day, then they have to go for non OPD. That there are different kinds of charges. These things we have to know. And there are, for admission, in the case of admission, there are different types of beds. There is general beds, special beds, semi special, like semi private, like that different varieties of beds are there. So for that also we have to know the charges and the procedure of admission. We have to know what all things are required for the registration, admission, everything. This information we have to collect and we have to record it everything in our record book. And then there is something called as SOP, that is standard operating procedure. It is also, it will be different for different departments, something like it will be unique for every department. So registration section, we and here this OPD we have to know what is their SOP. And then we have to know about registration process, like how they are registering, what are the informations that are needed, that is the demographic details, like the name, age, and then gender, then the address, their mobile number. And these informations are mandatory, and from where we have to get the, is there any registration slip we have to fill, and then how much the registration fees is there, how they are paying it, and then is there any problem they are facing while doing this. And then after registration, how they are guided to the next section. And in the case of admission also same thing, while getting admission, what are the documents that are needed. Similarly for admission also we need some details, like there is need for doctor's approval for admission, like referral in the case. And then there is some other requirements also, like details and all for admissions, all those things we have to know. And then how they are getting admitted, like the system process, if there is any particular system software in the hospital, we have to know how they are using it for registration, then how they are using it for admissions. And then selection of beds, there will be some advance for payments and all, it depends on hospitals. So advance payment, how much they have to pay. So as an overview, when we are posted in hospital posting in OPD department, these are the things that you have to ask, like the SOP, organogram, then staff number, their pattern, shift, and then salaries, then the hospital beds, the number of beds, categories of beds, charges of each bed, then the admission and the registration process is there, the documents required for admission and registration, then the patient flow patterns, and insurance is also there. Like insurance, when the patient is getting admitted, if most of the people now are having some kind of insurance, so when they are admitted, that time only we are asking them what all insurance, do they have any insurance claim. Like if they have an insurance claim and they are getting admitted, then they can have their claim. So like pre-authorization, we have to give some kind of documents, that too need some kind of documents. These documents we have to know about what all the documents are needed. And these things, we are asking the patients when they are coming, right, for admissions and all. So admission wise, when they come, we ask for insurance, are they having any claim, and the documents which are needed. These information has been told to the patients. And finally, if pre-authorization is done, so if they are having any kind of surgeries, they can actually claim the insurance. Only if they have the pre-authorization, then only they can go with the final, what are the documents are needed for after the surgery, and all these things they can actually do it. All this information we have to know. and these things we can get from the OPD department. So in this video, we got to know a little bit about OPD and what are the things we are get to know when you are posted in OPD department. So we will be coming with more videos to know about other departments in the hospital postings when we go there. So today I'm winding up. So stay tuned.